So Ruth, from a patient's perspective, when do you know to reach out to your physician about a change in your symptomatology or maybe something unrelated to myelofibrosis, a procedure that you might need to do that you want to inform your physician? What is the trigger to do that?
Well, again, I'm fortunate because I have a physician who says, call me for everything. I have access to her, and she says, if you have symptoms that you think are related or unrelated, I want to know. If you go to urgent care for any reason, I want to know. If you have dental work, I want to know. If you're having any kind of surgery at all, even if it's minor surgery, even if it's dental surgery, and that's so she can coordinate. She will get on the phone and talk to these other physicians to discuss my situation to make sure that I'm not going to have a bleeding disorder. You know, one of the things we know is that sort of live in this precarious place where you could bleed or you could hemorrhage, or you could bleed or you could have clots. And I have experienced both, unfortunately. And it takes a specialist's insight to walk another physician through, I think, what that patient could experience and what to look for. And I think that any good doctor values another set of eyes and ears. So if a patient is afraid to ask their physician because they think they'll insult them or make them feel inadequate or that they don't trust them, then they need to get over that. A good physician will only encourage you to get a second opinion and will only encourage you, I believe, to get a consult with somebody who knows more.
I'd agree with you more. And I would even say on the other side of that, from a physician perspective, I think if you are dealing with a physician that is not amenable to or embraces the second opinion, that's probably not the best physician for you. You should probably find a different physician, because I think a second opinion, particularly in rare diseases, is a very healthy thing to do. I mean, I don't mind patients I'm seeing want to get a second opinion from physicians in the city that do this too. I mean, I welcome that. So I think that's an important quality. I get nervous when other physicians are just uninterested in the discussing a patient, and or if you're going for a procedure and that proceduralist is not interested in discussing with your physician about your background and the potential complications, that's probably a red flag that maybe that's not the right person to do the procedure with.
I'm very fortunate that I have a physician who sees this role, her role, as much primary care as oncology. Obviously, there's a line there. I still have a primary care physician, but she looks at my whole being, my whole body, because this is a blood cancer. Obviously, we have blood running through our whole body. It affects our entire body. It's not the same as other cancers, solid tumor cancers. And that shared decision model, as well as shared model that allows for her to look more deeply into my primary care, I think is an amazing model that I'd love to see expanded.